Lianne has worked in haematology since 2006. She initially worked on a haematology ward, and after this, she was appointed as a late-phase haematology research nurse. Lianne has worked as a CLL CNS since 2015, where she looks after and supports patients that are newly diagnosed on treatment, post-treatment, and also runs specific nurse-led telephone clinics. Lianne has also set up or co-set up and run the UK CLL Nurse Forum meetings and was actively involved in the GP guide and our vaccination leaflet.
I think from Anna's first part of the talk, you can gather our role is actually really broad, and it means a lot of different things to a lot of different people. I ultimately see myself within my role as being here to help and support anybody with a diagnosis of CLL. And that means different things to different people. That can be picking up the phone and saying, just talk through the treatment indications to me again, or I've been given X, Y, and Z treatment booklets to go home with. What does that mean? Or it might mean that you're going on holiday and you want to know what you need to do about travel insurance, or you're struggling to get vaccinations at your GP surgery, or you don't know what vaccinations you need. It's a really broad role. Ultimately, I think we're here to support you, but also listen to your needs, be a point of contact, and also be that communication and that connection to the clinicians. We can easily access those clinicians and we can ask them questions and talk through your symptoms with them. And like Anna said, bring forward appointments as needed, but ultimately that point of contact to discuss concerns in between clinic appointments. So when we first meet you, as Anna says, we give lots of information out in the clinic, and in Oxford we offer a new patient telephone call, and that's normally done 4 to 6 weeks roughly after the initial diagnosis. But then we're there throughout the whole of your journey, so whether you stay under active surveillance, whether you go on to have treatment, or whether you're post-treatment, we're there throughout. We try and make sure that the information that we give to you is understandable and you actually understand the information that you're being given. Sometimes I worry that, particularly at diagnosis, that we give out so much information. We have patient packs, but we kind of do try and tailor it because it's not one size fits all, everybody's different. Some people want lots of information and some people don't want much information, but we try and make sure that there's information in there on what CLL is, what support services are available, so for example CLL support and leukemia care, and what those charities do and how they can help you. And then more local support services are available. So we're fortunate in Oxford, we have something called the Maggie's Centre, or there's a similar service called the Hummingbirds, which is in between Oxford and Banbury, and actually they're accessible for you as patients, but also for carers and relatives as well. It might be that you want to access financial support, or it might be that you want help with drinking, exercise, smoking, and there's places that we can refer to. So there's quite a lot of information, but on those phone calls we try and pull out the relevant information that's relevant for you, but making sure that you're aware of what services are available. And then, like Anna's already said, we try and go through what the B symptoms are, because we know that when you're seen in clinic, you can't necessarily remember all the information that you've been given, and some people can find it quite daunting going through the patient booklet. So we try and just go through on the phone calls what the B symptoms are, what the alert symptoms are. And as Anna's already said, we do repeat that on our nurse-led phone calls, even for people that have post-treatment, because we know it's important for that constant reminder of what to look out for. But often if you've had a CLL and received treatment, I often say to people, oh, how did it present in the first place? Why did you need treatment? And because sometimes people will ring up and say, oh, I've got these symptoms and these are the symptoms I had when I needed treatment before. So I think that constant education is important. And also for people that are on treatment, we know that with certain treatments, I know marmalade was mentioned earlier on, and there's other drug interactions. Some of the treatments like ibrutinib and acalabrutinib can increase the risks of bleeding and bruising and might need to be held before certain procedures. So I find that we're in a role where we're in a fortunate position where we can constantly educate and remind people of the key things to look out for. And I think at all points of the pathway, whether, as I say, you're newly diagnosed on treatment or off treatment, it's us being able to signpost to other services that can help you, or it might be that people need extra support at home, for example, or there's lots of emotional support available, but sometimes it's just knowing how to access that emotional support, or what's the right emotional support for you. And like Anna's already said, liaising with GP surgery so that we don't get that communication breakdown. And we did devise a leaflet together with CLL support to a GP guide, which in Oxford we have the template as a link and a QR code at the bottom of all of our clinic letters, so that the GP surgeries can also see what vaccinations we recommend, about antibiotic advice, about the fact that you often need a longer course of antibiotics, what the B symptoms are, and the blood parameters that we're looking at, which Anna Shu showed earlier on her slides. So I'll just touch a little bit on vaccines, because I know Anna's already gone through this, but again, we talk a lot about vaccinations, and we generally say and advise for you to have the seasonal flu vaccine, and we normally recommend for you to have that early on into the flu season. The pneumonia vaccine, the pneumococcal vaccine, and it's normally 2 vaccines at diagnosis. And we normally, particularly on the new patient follow-up calls, just highlight this information. Not everybody's normally had both the vaccines that we recommend. COVID vaccines, we only get told when that's been released at the same time as everyone else, but the spring vaccine's just been released. The last one was in autumn. You can actually book that either normally via your GP on the NHS website or with 119. And then the non-live shingles vaccine called Shingrix. RSV vaccine if you're in the right age category for that. And tetanus is normally just recommended if you have a serious wound, fracture or burn. Generally just say to people, if your gardening secateurs seems to be a common problem that comes up, you might just need to reach out just in case you do need a tetanus booster. And again, like Anna Shu said earlier on, we say not to have any live vaccinations. So treatment goals for the patients. I mean, you here in the room today will know better what your goals are than what I will know. And that varies from patient to patient because everybody's individual. Most people want to get the best response to CLL treatment with little or no side effects and have minimal time in hospital. Part of our role, even before you have treatment, is making sure that you've got good support around you. So again, do you need extra support at home? Even basic things like, do you have a telephone? Can you reach out to our triage unit that we use in Oxford if you get a temperature or you feel unwell or you have side effects to treatment? Are you able to get to and from hospital appointments if you've got friends or family members that can help with that? Or maybe you need hospital transport support, and enabling normality again in daily life. So, people might be really struggling with having fatigue and they want to, get back to hobbies that they enjoy. And then discussions around fixed-term treatment as opposed to continuous therapy. Again, often a lot of what our role is as a CNS is when you've been seen in the clinic and you've been given treatment information, is actually having phone calls and saying, what does that mean? What's the practicalities? How many appointments will this mean? What's the difference between fixed-term duration treatment or continuous therapy? What are the common side effects we see? And I do a lot of phone calls just talking through that with people in between clinic appointments. And we want to have minimal impact on your daily life and with maximum benefit to reduce the symptoms. So we do say in between clinic appointments, whether you're on or off treatment, do let us know about any symptoms that you're experiencing. And certainly if you're on treatment, if you felt unwell or had side effects, we'd be asking you to call up. And again, in Oxford, that'd be our triage unit. And again, just that key education on knowing what symptoms and side effects to look out for and making sure people, are having good quality of life. From our perspective, the treatment goals is all of that because we want to support you through that, but also enabling you to make informed choices and making the choices that are right for you as an individual. to have the best outcome on your quality of life. So, you know, again, part of our role is if people are ringing up saying I've had X, Y, and Z infections with this many antibiotics, we need to be informing the clinical team of that in between clinic appointments and looking at what things we can put in place, bringing forward appointments as needed. And also family members and carers are involved in this. Obviously, as long as the patient consents as well, it's often, you know, it can often be a partnership, so making sure everybody's well informed. And also making sure that we've got good compliance when you're on treatment and that you are reaching out for support if you aren't well in between clinic appointments is really important. And then a lot, again, we've mentioned a lot the long-term awareness of when to contact us, so side effects of treatment, fevers, infections, and the B symptoms. So hopefully that's given a little bit of an overview of what a CNS role is. I'm aware that not everybody has a clinical nurse specialist, and some people are managed by the GP. I know, again, CLL support and leukemia care, they often have nurses that you can speak to on the phone, and there's lots of resources available online. Hopefully everybody who's in a hospital setting does have access to a clinical nurse specialist, and if you don't have access to one, then, you know, ask your doctor who your named clinical nurse specialist is. I hope that we in Oxford build up good relationships with our patients, and we want to have good communication, and we hope that we really listen to what people's needs are. And we can't always have the answers to all the questions, but we can certainly seek advice from our doctors and get the answers to your questions in between those clinic appointments. Okay, thank you.